Basically, if you don't, all of these pills and shots and surgeries, they all require a lifestyle habit change. Right? There's no way around it. There's no shortcut, people. There's no shortcut. Weight loss drugs and medicine treatments. I want to discuss weight loss drugs and medicine treatments. I want to discuss the pros and cons and the long-term effects, whether they benefit or damage our bodies in the long run. I want to shed a light on these things. There's a lot of advertisements going around about it all over television and social media, and I'm noticing the craze. I'm noticing the wave, especially amongst the women. Let's talk about it, guys. Let's talk about it. I'm noticing the trendiness. You know, and women are typically trend followy, but I'm noticing the trendiness amongst the women, and the way they're trying to shortcut the process. You know what I mean? And it's not the healthiest. It's not the best. And it doesn't look the best. Most importantly. Oh hell no! So let's go into it. The landscape of medical weight loss has fundamentally shifted, moving from basic stimulants to advanced hormone mimicking injections and surgical structural changes. Now this is important because mimicking hormones sounds sounds unhealthy. It sounds healthy in the short term, but yeah, when you're tricking your body, you know what I mean. It can't possibly be a good thing, because the body doesn't lie. You know, the body doesn't lie, and if you trick the body's going to tell you, hey, stop playing with me. You know what I'm saying? When analyzing these interventions, they split into 5 core modalities. First, you have GLP-1/GIP receptor agonist, CNS or central nervous system appetite suppressants, fat absorption blockers, surgical interventions, and endoscopic procedures. And I think these things, this list I just mentioned, I think this covers it all. This is everything that I know of that the women are flocking to, and that are making things weird. It's making things weird in the streets. Oh my God! So let's get into the first one: GLP-1 and dual incretin receptor agonists. These weekly injections mimic naturally occurring gut hormones, GLP-1, glucagon. And I failed to admit, when I talked about insulin and cortisol and the relationship between insulin and cortisol, I did not cover glucagon. Glucagon is actually what the pancreas produces. I guess, correct me if I'm wrong, any medical professionals, correct me if I'm wrong. The pancreas produces glucagon and insulin. I'm not too sure, but medical professionals, please correct me. But GLP-1, glucagon-like peptide 1, and GIP, glucose-dependent insulinotropic polypeptide. No wonder they made it an acronym. Glucose dependent. Now remember, glucose, glu meaning the blood, glu or gly meaning the blood, and kos or os meaning sugar, blood sugar, glucose being blood sugar. So glucose dependent insulinotropic polypeptide. Polypeptide is like the kind of the purest form of a protein, like an amino acid sort of. And insulinotropic, so meaning that it has to do with insulin, obviously, but it kind of assists the insulin. So like a lot of times when you eat, it's the insulin that keeps your blood sugar down, which helps reduce you becoming fat. Also, ultimately from whatever meal that it is you're eating. Every time you eat, you spike your insulin. I ain't gonna say spike it, but you raise your insulin because the pancreas has to keep your digestive level down so that you won't store as much fat. So yeah, GLP-1 and GIP, they delay gastric emptying, stabilize blood sugar, and signal the brain's hypothalamus to suppress appetite. So yes, when your insulin raises, that's the stomach is now telling your brain that, oh, you're full now, you're not hungry anymore. When people eat a lot of carbohydrate heavy foods, they spike their insulin because they're taking in so much sugar. The carbohydrate breaks down as sugar. They spike their insulin, and the insulin has to keep up with all of those carbohydrates, all of that fried food and the potato and the bread, right? The insulin has to keep up with all that, and so the stomach is saying, hey, produce more. The stomach tells the brain, hey, produce more insulin, and then the brain tells the pancreas, go in overdrive, and this is how you become diabetic, or this is how you become fat, right? So it signals to the brain's hypothalamus to suppress appetite. So the common names of GLP-1 and GIP are semaglutide. Remember glue for the blood, right? Semaglutide, or the marketed names are Wegovy and Ozempic. Let's talk about it. This is new. I've been seeing this in the streets. Tirzepatide. And then the marketed names for tirzepatide are Zepbound, and Mounjaro. I've heard of that too. And lastly is the liraglutide. Remember glue for the blood, right? Liraglutide, or the marketed name is Saxenda. 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 Let's talk about the benefits of these GLP-1 and GIP receptor agonists. They call it agonist because it suppresses appetite. It's antagonizing your appetite, right? It suppresses your appetite. So it's a dual incretin receptor agonist. So the benefits: profound mass reduction. So it yields an average of 15% to 25% total body weight loss, closely rivaling surgical outcomes. So this is saying all you gotta do is take a shot. Take a shot instead of getting surgery. You ain't gotta go under the knife. You can just take a shot. Stab yourself in the belly and you're good, right? Cardiovascular and organ protection decreases risk of major adverse cardiovascular events like heart attacks and strokes by roughly 20%. So the surgeries are less safe. They reduce systemic inflammation, they lower blood pressure, and offer clinical protection against diabetic kidney disease. Yes, so if your appetite is being suppressed, even if you're not eating healthy, you're not eating as much. So your blood sugar is going to stay low, and you'll be less likely to become diabetic. Metabolic correction significantly enhances insulin sensitivity and clears ectopic fat. So the fat stored in organs like the liver. So the ectopic. So wait, what's the other kind of fat? There's the fat under the skin, and then there's the fat around the organs. I never heard of ectopic before, but okay, we'll roll with that. So yeah, these are the short-term benefits. These are the short-term benefits. You know what I'm saying? You're gonna be an instant baddie, right? Right? Let's go. So now let's talk about the long-term disadvantages and bodily harm. Because remember, you're tricking the body, and the body doesn't lie. All right. So the long-term disadvantages and potential bodily harms: sarcopenia, severe muscle wasting. You lose a lot of muscle. Because weight loss occurs rapidly, up to 40% of the drop. Remember, your appetite is being suppressed, so you're not eating as much. You're not getting as much proteins and nutrients, right, that the body needs. You know what I mean? But your brain is being tricked into telling you that you're not hungry. So you lose. So now you're losing muscle mass. And this is how these women, they get on these shots, and they start looking like pretty zombies. It's terrible.
Oh my God!
No, ladies, no. Because weight loss occurs rapidly, up to 40% of the dropped mass can come from lean muscle tissue rather than adipose fat tissue. So they look like deflated balloons pretty much, if not combated with heavy resistance training and high protein intake. So yes, your appetite may be being suppressed, but in the suppression of your appetite, you still have to up your protein and lift some weights. You want to, if you're going to shed that fat, if you're going to shed so much fat, you need to, what the suppressant is doing is it's shedding fat and muscle. So you want to maintain the muscle while you shed the fat. And I think that's the healthier way to go about it. This permanently damages the resting metabolic rate. So like there's a part of you that is physically resting, like when you sit down or lay down or take a nap. But then there's a part of your body that is metabolically resting, where your body is undergoing all of its changes and processes to create a stasis, to create a healthy level, right? And when you take these shots and you trick your brain, the body never knows when to go into this resting state. And you know, once again, like I said, the body doesn't lie. And if you trick the body, the body's gonna let you know that, hey, something ain't right. You know. So the next one, so that was sarcopenia. Those are long-term disadvantages of GLP-1 and GIP. So the first one was sarcopenia, severe muscle wasting. The second is stomach paralysis and bowel blockages. This can induce gastroparesis, chronic stomach paralysis, causing food to ferment undigested in the stomach. Oh my God, no. That is disgusting. Leading to severe intractable vomiting, chronic slow motility, and can progress to life-threatening bowel obstructions. No. That's terrible. And once again, this is because you're tricking the body, and the body doesn't lie. So the body's gonna tell you something ain't right. Something ain't right. Sarcopenia, severe muscle waste. These are long-term disadvantages of GLP-1 and GIP. Sarcopenia, severe muscle wasting, stomach paralysis, and bowel blockages. The third, pancreatic and biliary damage. Places structural stress on the biliary system. Rapid shifts in bile composition. Bile is is produced from the liver, and that helps. I forget what bile does, the purpose of bile. So biliary or biliary places structural stress on the biliary system. So your appetite is being suppressed. You're tricking your body, and now you're tricking you're tricking your brain. You're tricking your pancreas that's attached to the stomach, and now you're tricking your liver. Rapid shifts in bile composition increase the risk of gallstones and acute cholecystitis. Acute cholecystitis, and chola meaning the colon, having to do with the gallbladder and the what helps you move your bowels, right? Medical professionals, please correct me. Often necessitating surgical removal. So yeah, I just had a friend. If she may or may not be listening to this, but she just went through gallstone surgery. And it's not cool. It's not cute. It can also trigger acute pancreatitis, which is relative to diabetes, which can cause permanent organ damage. Yes, come on, guys. So we talked about long-term disadvantages of GLP-1 and GIP. The next one, the rebound and lifetime dependency. These drugs do not cure the underlying metabolic baseline. They manage it. Pay attention. It's not a cure. It just manages it. Clinical data shows patients regain roughly 2/3 of lost weight within 12 months of cessation. So once you stop taking it after a year, you're gonna put the weight right back on because the brain is like, wait a minute, you've been tricking us. let's get back to normal. Let's get back to normal. What are we doing here? Turning these into lifetime commitments. So basically, you take it and you take the shot for however long you take it, and you get the quick fix, and you become an instant baddie, right? But now you're stuck on it forever, because the minute you stop taking it, no more baddie. See what I mean? Cosmetic structural shifts. The Ozempic face. This is what I be talking about. Rapid subcutaneous, meaning under the skin, rapid subcutaneous fat depletion in the malar or the cheek pads causes rapid skin sagging and prematurely aged facial aesthetic. No. Terrible. No, we cannot have that. No.
Oh hell no!
This is what I be talking about. The pretty zombies. This is what I be talking about. No. So the long-term disadvantages of GLP-1 and GIP, or the Ozempics and all of that, the shots, right? The long-term disadvantage of the shots: sarcopenia, severe muscle wasting, stomach paralysis and bowel blockages, pancreatic and biliary damage. So you damage your pancreas and your liver. Those are the two sisters of the digestive system, right? And then you create a lifetime dependency, or you relapse, you gain the weight back and you have to put it back on again. Terrible. All right, let's get into the CNS appetite suppressants, central nervous system appetite suppressants. These are daily oral pills, stimulate neurotransmitters like norepinephrine, dopamine, or serotonin, or modulate addiction pathways in the brain to dull cravings and elevate satiety. So basically, these don't suppress your appetite. They just make you think you're full. They just make you think you're full sooner. They don't necessarily suppress the appetite. So common names: phentermine topiramate, or the marketing term is Qsymia, 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 or Qsymia. I don't know how to pronounce it. The next one is naltrexone bupropion, or the marketing term is Contravi. I've seen the commercial for that one. And lastly, you have phentermine alone. So the first one was phentermine topiramate, and this one is just phentermine alone. The marketing term is Adipex P. The benefits. Let's look at the benefits. Affordability and accessibility. Highly cost effective, as opposed to the shots, right? As opposed to the GLP-1 and GIP. They're highly cost effective compared to biologics, easily administered orally, and effective at disrupting emotional or stress induced eating patterns. Yes, so these it's affordable and then it's accessible, right? That's always the catch. There's moderate efficacy. So produces a steady 5% to 10% reduction in total body weight, which is clinically sufficient to improve lipid profiles and vascular tone. So yeah, you don't become a baddie overnight. You become a aight baddie. You know what I'm saying? Let's get it. Now let's get into the long-term disadvantages. This list isn't as long as the Ozempic shots or whatever. So let's see. Sympathetic cardiovascular strain. Pure stimulants like phentermine force chronic activation of the fight or flight nervous system. Chronic activation of the fight or flight nervous system. So this messes with your nervous system, not even your digestive system, your nervous system. No, this is ridiculous. Prolonged use causes resting tachycardia, tachycardia or tachycardia, cardia meaning the heart, having to do with the heart, elevated heart rate, and hypertension. So you're losing fat, but you're raising your blood pressure. There's no shortcuts to this, guys. There's no shortcuts. Accelerating myocardial strain and cardiovascular wear. So basically, you're giving yourself a heart attack.
Oh my God!
No, terrible. Neurological and psychological toxicity. Topiramate is notorious for causing cognitive dulling and speech fragmentation and memory issues. No, wow. Often colloquially termed Dopamax. Wow. Bupropion alters neurotransmitter baselines and can increase anxiety, trigger severe insomnia, and elevate seizure risk in vulnerable individuals or exacerbate clinical depression and suicidal ideation. No. This is terrible. But it's affordable and accessible, right? It's affordable and accessible. Hey, come on now. Metabolic acidosis and renal stones. Renal having to do with the kidneys. Carbonic anhydrase inhibition from components like topiramate can induce metabolic acidosis and increase the lifetime formation of painful kidney stones. So the shots cause gallstones. The pills cause kidney stones. There's no shortcut, guys. There's no shortcuts. This is crazy. All right, number 3. So the long-term disadvantages of the pill and appetite suppressants, cardiovascular strain. So it messes up your heart. It dulls your brain, because remember it's blocking the signals to the brain that you're hungry, or tricking your brain into thinking that you're full. So it's messing with your brain, and then it gives you kidney stones. No. All right. So gastrointestinal fat absorption blockers, an oral medication that acts locally with the lumen of the gastrointestinal tract without entering the bloodstream. It binds to gastric and pancreatic lipases, inhibiting them from breaking down dietary fats. So the common name is Orlistat, or the marketing term is Ally and Xenical. The benefits: non-systemic safety, does not affect the central nervous system. Okay. The heart rate or the metabolic hormones. It has an extensive decades-long safety track record. Okay. So this is the fat absorption blockers. Okay. Modest fat excretion induces a controlled 5 to 7% weight reduction while training patients to strictly avoid high-fat meals. Okay, this is good. The long-term disadvantages: severe gastrointestinal distress. Unabsorbed fat passes directly into the large intestine, causing flatulence with oily discharge. So you're sharding, basically. Fecal urgency. You got to run to the bathroom.
Oh hell no!
Steatoria, foul or oily stools, and accidental bowel incontinence. So you just a pooping machine. No. So that's gastrointestinal distress. So the fat just passes directly into the large intestine. It doesn't even go through the body. You just pooping crazy. Systemic fat soluble vitamin deficiencies. Long-term inhibition of lipid absorption prevents the body from uptaking essential fat soluble vitamins. So there are certain vitamins that you need fat in order for your body to digest. And if you don't have a certain level of fat in your body, you can't have these vitamins. Vitamin A, so you start lacking vitamin A, can lead to night blindness and mucosal breakdown. Your nose starts to get real runny. You know what I'm saying? This is terrible. Vitamin D, you start lacking vitamin D, so that causes downstream calcium malabsorption, so your bones get weak, resulting in severe bone density loss. I just said that. Osteo having to do with the bones, osteopenia, and structural fractures. So you start getting brittle. You just start getting brittle, like it's no terrible. Lacking vitamin E disrupts cellular antioxidant defense. You get sick easy. Leading to potential neurological abnormalities. Terrible. And you lack vitamin K, impairs the coagulation cascade, causing bruising and poor blood clotting. Terrible. Nope. And then the last long-term disadvantage is hepatic strain. Through rare long-term use, has been clinically linked to severe acute liver injury. HEPA meaning having to do with the liver. All right, we rolling. Follow me. We still got. So we're gonna talk about. So far we talked about GLP-1. We talked about the central nervous system, appetite suppressants, and then we talked about the gastrointestinal fat absorption blockers. Now we're gonna talk about bariatric surgery and the endoscopic procedures. So now we went from taking shots, stabbing ourselves in the belly, to popping pills, to now we're talking about going under the knife. This is where it gets serious. Major invasive surgeries that permanently alter the anatomy of the gastrointestinal tract to enforce restriction, reducing stomach volume, and or malabsorption, bypassing parts of the small intestine. So they either cut off one of the tubes in your stomach, or they cut off a piece of your stomach, or they pinch your stomach. I don't like these things. They do these things, and some people may feel like it's necessary, I guess. Sleeve gastrectomy, removing roughly 80% of the stomach. No, that's crazy. No.
Oh my God. Oh hell no.
80%. That's great. That's wild. Roux-en-Y gastric bypass, creating a tiny thumb-sized pouch and rerouting the small intestine. That's crazy. That's nuts. That's nuts. And all because you can't go to the gym. All because you don't want to go to the gym. All because you don't want to eat healthy. You know what I'm saying? Like, this is crazy. And those exceptions, please don't do me. Get away from me. I get it. The doctor recommended it. You have a issue, a medical issue. I get that. I get your medical issue. I understand. But you're not the majority. Let's keep that a bean. You are not the majority. You know what I mean? There are people out there who want to shortcut and want to, take the easy route to a healthy lifestyle. And, all of these long-term bodily harms I just mentioned, it's like really, you're that desperate? Really? So yeah, knowledge is power. Knowledge is awakening. Knowledge is this is definitely waking me up. And I never had the inkling or the iota of the desire to want to do any of this stuff. And it's crazy. It's crazy just reading about it. So the benefits: maximum sustained mass loss, the gold standard for severe obesity. So yeah, this is that my 600-pound life type stuff. Severe obesity, achieving a permanent 25% to 35% reduction in total body weight. So immediate type 2 diabetes remission. So a lot of people so if you haven't reviewed my previous videos on diabetes, it goes from pre-diabetic to pre-diabetic to type 2 to type 1. Type 1, you're pretty much terminal, where you're going to have that condition for the rest of your life, and whatever treatments you may require, especially dialysis, which is the worst. So type 2 is like the medium, where it's it goes from pre-diabetic to type 2. And so you basically, if you get one of these bariatric surgeries, you immediately remiss being type 2. You immediately rerouting the intestines alters gut peptides, like GLP-1, almost instantly. It alters gut peptides almost instantly, often resolving insulin resistance, because remember, when you're diabetic, when you're type 2 diabetic, the pancreas has to work overtime producing insulin, and it kind of shuts down after a while. It wears out, and that's how you become type 1. So often resolving insulin resistance and putting type 2 diabetes into complete remission before major weight loss occurs. So you lose the diabetes and then you lose the weight. And I think these are the conditions where I think doctors would actually recommend these kinds of surgeries. You know what I mean? And this is more serious, and this isn't the people looking for the shortcut. So even though I'm throwing shade, is really no shade. You know what I'm saying? So now let's talk about the long-term disadvantages. Irreversible structure alteration. The stomach tissue is surgically excised or permanently bypassed. The normal anatomy cannot be restored. So they cut off 80% of your stomach. So like your stomach will never be the same. Like that's sick. That's fucking sick. Lifelong severe malabsorption, bypassing the duodenum. I forget what part of the body that's on, and proximal jejunum. Permanently damages the body's ability to extract micronutrients. So remember we talked about with the fat absorption blockers and how you can't absorb the vitamins, the key vitamins you need for your body, your bones, and your heart, and all of that. These gastrointestinal surgeries, like they make that even worse. The patients require intensive, lifelong blood monitoring and high dose supplementation to avoid. So the pernicious anemia, due to lack of intrinsic factor needed to absorb vitamin B12, which is important for your nails, skin, and hair. Correct me if I'm wrong. Causing permanent peripheral neuropathy and neurological damage. Yeah, so yeah, your nervous. So once again, it damages your nervous system. Severe iron deficiency anemia, chronic fatigue, and tissue hypoxia due to structural inability to process iron. There we have it. Accelerated osteoporosis, osteo having to do with the brain, or with not the brain, the bones. Rapid bone demineralization caused by chronic calcium starvation. And these are all the malabsorption effects. The dumping syndrome, rapid transit of undigested hypertonic food into the small intestine triggers massive fluid shifts. This causes severe abdominal cramping, profuse sweating, palpitations, and dangerous bouts of reactive hypoglycemia. Gly having to do with the blood. There's hypo and hyper. Hypo means not enough. Hyper means too much. So crashing blood sugar. So that's the dumping syndrome, because the stomach is too small to actually digest the food you eat. So it just dumps a lot of the food into your small intestine, and then your body has to react that way. Next, mechanical and structural failures. This is from bariatric surgery. Over time, chronic irritation can create marginal ulcers, structures, narrowed scar tissue that block food passage, and internal hernias where loops of the intestine become trapped and strangulated. Ooh, no, that's terrible. No. Requiring emergency surgical intervention. That's crazy. No. That's sad. That's sad and sick. Psychological shift and addiction transfer. Post-surgical anatomy changes how alcohol is metabolized, leading to rapid spikes in blood alcohol levels. This heavily increases the long-term risk of developing alcohol use disorder. So it spikes blood alcohol levels. Wow. So it basically turns you into alcoholic. You cutting out pieces of your stomach turns you into an alcoholic. That's crazy. That's nuts. No. All right. Whew, we made it this far. Endoscopic procedures. Less invasive mechanical options performed via an endoscope lowered down the esophagus through the stomach, avoiding external surgical incisions. So you're basically going down your throat to your stomach, as opposed to cutting a hole in your stomach. That's pretty weird. So the benefits: no incisions, right? You're not cutting a hole in your stomach. You're just going down your throat. Done as an outpatient procedure under sedation, lowering immediate surgical infection and recovery risks. Okay, great. That sounds medically compromising, in a good way, right? Bridge therapy provides a moderate 10% to 15% weight loss to help patients lower their risk profiles before undergoing other major medical procedures. So I guess if weight loss can be an issue for something else, they'll say, hey, we don't necessarily need to put you through any kind of bariatric surgery. We can just go endoscopic. You know what I mean? And that way, you can still lose the weight for whatever surgery it is, and so it sounds like a win-win, right? Let's see. So let's talk about the long-term disadvantages and potential bodily harm. Intragastric, so temporary and short-lived. Intragastric balloons must be deflated and surgically removed after 6 months to prevent the acidic environment of the stomach from degrading the materials. Weight regain occurs rapidly post-removal if lifestyle habits were not altered baseline metabolism. So ulceration, migration, and perforation. The constant mechanical pressure of a foreign object against the gastric mucosa can cause deep stomach ulcers. If a balloon deflates prematurely, it can migrate to the lower intestines, causing acute bowel obstruction that requires emergency open surgery. So this is the risk. This is the risk. So you have all of these benefits, but if something goes wrong, we still got to cut you open.
Oh my God!
Who wants that, right? So yeah, it's still not. there's no shortcut. All right. Whew. So across all non-surgical pharmaceutical interventions, weight loss is a managed state, not a permanent cure. So that means you have to actually earn it. You have to actually put your mind to it and work towards it in a gym and in your kitchen, in the grocery aisle. There's no shortcut to this whatsoever. No matter how much we try, the body will not lie. The body will not lie. It can't. The moment a chemical intervention is removed, the body's homeostatic, or meaning back to normal, if you will, a homeostatic or set point aggressively drives appetite upward to regain the lost mass. So the minute you stop taking the pills, the minute you stop taking the shot, the minute you recover from the surgery, your body's saying, "Oh, we back to normal. This is what we doing." And it's you gonna do. And this is how so many people put the weight right back on. This is how so many people would put the weight right back on, because ultimately there are no shortcuts. Furthermore, the single most dangerous, underreported risk across all rapid weight loss methods, especially GLP-1s, is the simultaneous loss of lean muscle mass. Stripping up to 40% of weight from muscle permanently drops the resting metabolic rate. If a patient stops a medication with less muscle than when they started, their baseline caloric burn is severely compromised, causing them to regain fat at an accelerated rate. This is how they put the weight back on so quick, because the body's trying to get back to normal before the weight loss method, and because you lost so much muscle, now it's just putting on fat. This is terrible. Preserving long-term health on any medical protocol requires aggressive resistance training and maintaining high daily protein intake to guard structural lean mass. Yeah. So once again, there's no shortcut, like I've been saying. So for any of you watching or listening, you know what I mean, I hope this did something for you. I hope this did something for you. If you've already had any of these weight loss methods done, I hope it opened your eyes in some sort of way. If you were considering having any of these weight loss methods done, I hope this opened your eyes in some sort of way. And I hope you can, and whatever side of the coin you are watching this video from, I want you to understand that there are no shortcuts. There are no shortcuts. As much as we would like, there are none. And there's nothing more rewarding than getting 30 minutes on a treadmill and eating more vegetables and getting more sleep and catching yourself in the mirror, walking by your mirror in your bathroom and catching yourself and saying, "Oh shit.
Oh my God.
Look how good I look. Look at what my body's doing. Look at my body not lying to me," right? There's nothing more rewarding than that. And there's no shortcut to being a baddie, ultimately. So take that and do what you will with it.
Tired of guessing what your body really needs? Intelligent Wellness creates a plan made just for you. Your grocery list, your sleep, your workouts, your meals. No stress, no guesswork, just the right choices for your body. Start today at prosperunlimited.com/wellness or scan the QR code wherever available.